This is a 61 years old female, known case of hypertension, and she has a to rule out any CAD. The drop was negative. On HC, there was a mild ST depression in the anterior lead, and TMT was positive. So this is angio. You can see this is the epicranial view, and you can clearly see this is the right atrial root. Clearly see there's a almost 90% stenosis in the just after the diagonal one in the LAD. Long lesion it was. And there's areocranial view also you can see, and there is a osteal disease in the diagonal one, also significant disease, but diagonally seems to have less than 1.5. So there's a in LAD right from the after diagonal, before diagonal there is a significant disease, stenosis. Decided to do the angioplasty to this patient. So with actually the catheter, there was a problem in going this guide catheter through radial route, so we changed the route to femoral, and there was a lesion in the osteal diagonal one, so we decided to keep one wire in the diagonal and one in the LAD. So if something happens, if diagonal gets pinched and all, then we can do something for the diagonal. Already there was a TMT flow, but diagonal was so small, it was almost 1.5. So here in this LAD, there may be a difference of opinion. From the mid LAD, there's a size of 2.75, and in proximal LAD, there was a size of 3. So we decided to take a 2 stent, one in the mid LAD and one in the proximal LAD, to get a better size, because the proximal size was 3 and the mid size was 2.75. So with this right femoral root, we started. This is a BMW PTCA wire, one in the diagonal one and one in the LAD. We made a knuckle of the wire in the LAD because there was a tortuous turn in the LAD. So this was the placement of the first stent, which is in the mid LAD, 2.75 into 18. There's the epicranial view. And this was a stent deployed at 14 atmospheric pressure. The nominal was 8, RVP was 16. And this was a second stent, diameter of 3 into 18, and deployed at 40 atmospheric pressure. 8 was nominal and 16 was RBP. So we kept that overlapping segment just below this diagonal opening, because we didn't want to get this diagonal pinch, and already wire is there in the diagonal, so this wire got gelled after this stent deployment. And this was the overlapping of the stent with the same balloon. And this is the scene after deployment. There was no pinching of diagonal. Diagonal has not closed. Diagonal has a TMT flow. So we decided to leave the diagonal and we come out with this gelled wire. So we had a fear of getting this diagonal closed after the stent deployment. After that, in the proximal stent, we did the NC. And this is the picture. This is epicranial view, and you can see diagonal is flowing TMT, and after NC, this is a picture. So diagonal is also got saved, and this is the angioplasty to the LAD. This is the areocranial view after NC. This is the picture. So this is the angioplasty to the proximal and mid LAD. Doing a size difference, we used 2 stent. The proximal is 3 and mid is 2.75 in this unstable angina patient.